What are common types of movement disorders? Have you ever wondered what movement disorders are? These are neurological conditions that affect how we control our movements, both voluntary and involuntary. Understanding these disorders is important, especially when considering well-known conditions like Parkinson's disease. Let's explore some common types of movement disorders. First up is Parkinsonism. This term includes Parkinson's disease and other related conditions that share similar symptoms. Parkinsonism is marked by four main symptoms: tremor, which usually occurs at rest, bradykinesia, meaning slowness of movement, rigidity or muscle stiffness, and postural instability, which leads to balance problems. The cause of Parkinson's disease is the loss of dopamine-producing neurons in a specific area of the brain, leading to these motor symptoms. Other conditions may mimic these symptoms but have different underlying causes. Next, we have dystonia. This disorder involves sustained or repetitive muscle contractions that can cause twisting movements or abnormal postures. Dystonia can affect just one part of the body or be more widespread. It is separate from Parkinson's disease but can sometimes occur alongside it. Tremor disorders are another category. While tremors are often associated with Parkinson's disease, there are other types, such as essential tremor. Essential tremor is characterized by tremors that occur during voluntary movement, unlike the resting tremor seen in Parkinson's. Chorea and Ballism are also significant. Chorea includes irregular, rapid, involuntary movements that seem to flow from one muscle to another. Ballism is a more severe form, involving violent, flinging movements, often seen in conditions like Huntington's disease. Then we have Myoclonus, which refers to sudden, brief muscle jerks that can happen in various neurological disorders. This is different from the tremors and rigidity found in Parkinson's disease. Hemifacial spasm is another type of movement disorder. It involves involuntary contractions of muscles on one side of the face, often due to compression of the facial nerve. This is distinct from Parkinson's disease but is an example of a movement disorder related to peripheral nerves. Tics and Tourette syndrome are also noteworthy. Tics are sudden, repetitive movements or sounds, while Tourette syndrome includes multiple motor and vocal tics. These differ from the more progressive symptoms of Parkinson's disease. Lastly, ataxia is a disorder that primarily affects coordination. It leads to unsteady and clumsy movements due to issues in the cerebellum. Ataxia is not classified as a Parkinsonian disorder, but is part of the broader category of movement disorders. In summary, movement disorders encompass a variety of conditions that impact motor control. Parkinson's disease is a key example, but many other disorders exist, each with unique features and causes. If you or someone you know is experiencing unusual movements, it is important to consult with a neurologist or a movement disorder specialist for an accurate diagnosis and tailored advice.